Very much, Courtney, joined now by Wendell Potter, an author, the book Deadly Spin, but not just an author. Wendell, you have a long history of journalism, working both in the state of Tennessee and Washington, D.C., and as well as a PR communications executive in the healthcare industry. I suppose you could say your experience is broad enough that we can call you an expert on healthcare.
Well, you can do that, and I'll accept it.
Yeah.
I've worked 20 years inside the health insurance industry, and since I left the industry, I've been serving as a healthcare reform advocate in the United States and spent a lot of time in Washington.
You title anything Deadly Spin, you're going to get people's attention. Is it fair to call this book one in which you essentially blow the doors off or pull back the curtain on healthcare lobbying and where money's spent and insurance, essentially the industry as we come to know it?
Exactly, and it's a look at just what the health insurance industry in the United States does with their premium dollars to get people to think and act, really, in many cases, against their own best interests, and how they spend so much of our premium dollars on lobbying members of Congress and other lawmakers.
Wendell, you know, it's so interesting here in Canada. Of course, I know that internationally our healthcare system has a reputation. I believe for the most part it's one that we're proud of, but we often compare it to the United States. There are certain benchmarks with which we can justify certain investments of tax dollars or social programs. You made national headlines addressing the U.S. Senate. What was your main message to the U.S. Senate when it comes to healthcare reform?
My main message was that people need to understand how Wall Street affects whether or not they have access to health care, and just what it means to have a privatized healthcare system and a system that is largely controlled by shareholders, which is the way we have that's how our system is really set up in the United States, and what the consequences of that are. And I explained how the practices of the health insurance industry have resulted in 50 million Americans not having health insurance, how their practices have been such, how we've allowed them to refuse to sell coverage to people who really need it, and how much of our premium dollars are spent on things like lobbying and advertising, and how much is going to profits, going right into the pockets of rich shareholders.
As Canadians, we're fascinated to see the introduction and the rollout ultimately of Obamacare. It's what we've come to understand, with certain exceptions, to be more of a move toward health care for everybody. Do you expect things to change? Are things going to start looking a little bit more, if I can say, Canadian, stateside?
I think so. I think it's the beginning. I call the Obamacare the end of the beginning of reform in the United States. We've been at this for 100 years down there. We didn't do what you did back in the 60s to try to really establish a system. We just allowed it to develop as it did, from private businesses doing what they did to make money. And that's why we have one of the world's most inequitable healthcare systems, and also the most expensive. And Obamacare will begin to change things.
I know that you're here to talk to those that will be attending the Public Interest Alberta annual conference, and you're no doubt going to hear from a lot of people that a lot of the talk around our healthcare system here in the province, Alberta Healthcare Services, the government's taking shots about transparency. They're talking about bloated executive pay. They're talking about queue jumping. It's not without its problems.
Certainly.
If you look to the United States, though, it seems like you've identified one of the major problems as lobbyists misusing or misallocating millions of dollars for a PR campaign. Is that fair to say that that's one of the biggest issues that you've identified?
Exactly, and what I will point out is how this happens over time, and how when you have privatization, when you have private companies that get entrenched, they amass a lot of power and influence and money, and they use that money to try to, and do successfully, influence public opinion and public policy to their benefit, and that is the danger.
Is it an unfair question to ask you straight up, a blanket question? Is the Canadian healthcare system better than the American healthcare system?
I think there's no doubt it's better, and I will be showing some charts and graphs just showing how our system in the United States compares with the Canadian system, and how much more it costs here, and how much more equitable the healthcare system is here.
Wendell Potter is an expert on American healthcare. He has addressed the U.S. Senate, and he will be addressing an audience tomorrow at 9 a.m. at the Chateau Louis Hotel as part of Public Interest Alberta's annual conference. All of the details, as well as a link to Deadly Spin, and where you can learn more about that on our website under the Inside BT link. Thanks for being here, Wendell.
Thanks, Ryan.
Nice to meet you. Breakfast Television back after this. Courtney, Zia, Michelle have your news, traffic, and weather covered in just a minute.